My name is Pim vanOoij, and this is the showcase for my talk entitled Detection of Regurgitated Flow Using 3D Averaging of Normal Heart for the Pulmonary. So regurgitation is abnormal backflow over the heart valves and may lead to heart failure and can occur over any of the 4 valves. Echocardiography may miss eccentric flow jets, and MRI is the current gold standard by, for example for mitral regurgitation, subtracting the aortic flow measured by 2D flow MRI from the left ventricular stroke volume as calculated by standard CNA. However, this is an indirect calculation. For this reason, direct quantification techniques were developed for 4D flow MRI. We found that in severe cases, tracking of the flow jet rather than the valve resulted in better correspondence with the indirect method. But flow tracking involves manual work and does not account for multiple jets if they are present. So can we design a method for fully automated detection, visualization and quantification of regurgitated flow using 4D flow MRI? So we performed 4D flow MRI in 10 patients with congenital heart disease and 17 healthy volunteers and segmented the heart on time-averaged phase contrast MR angiograms. We co-registered the volunteer data and interpolated the velocity vectors to one volunteer segmentation and calculated the average velocity for each voxel over all volunteers. Then we registered and interpolated the volunteer average to the patient segmentation. And we performed volume rendering and quantification of the voxels, where the velocity magnitude was higher than 2 times the upper boundary of the 95% confidence interval of the volunteers, and where the velocity direction deviated more than 90 degrees from the volunteer average. So here we look at a time series of tricuspid regurgitation and found that there was no correlation between flow tracking and abnormal flow, for the reason that the novel method also picks up abnormal flow in other locations. So for this time series of pulmonary regurgitation, we did find a good correlation between flow tracking and abnormal flow quantification. So for all patients, there was a significant correlation between the time-averaged flow tracking and abnormal flow volumes. So the proposed methodology has potential for automatic detection, visualization and quantification of abnormal flow and provides simple visualization and quantification of complex flow that could be relevant in a clinical setting.